Welcome to the Continuing Education module entitled Well-Being Strategies for Caregivers, Wellness for Healthcare Professionals. Our agenda for this module includes the following. First of all, we're going to look at what makes wellness so difficult in healthcare settings. Secondly, we're going to look at some of the unique wellness needs of caregivers. Third, we're going to talk about the key well-being strategies for caregivers. Fourth, we're going to look at strategies for maximizing your wellness program's results, which overlay onto those unique well-being strategies that we talked about just previous. What makes wellness an organizational imperative in healthcare? What will it take to move forward? And finally, a summary of key points. Now let's start with why wellness is so difficult with healthcare workers. First of all, we have somewhere around 13 million healthcare workers in the US, and that includes people who are working in the health insurance industry, the direct healthcare provision types of activities like hospitals, clinics, laboratories, long-term care facilities, skilled nursing facilities, home health agencies, laboratories of various kinds, all of the variety of context around healthcare workers. There's also a very strong treatment bias throughout those 13 million plus healthcare workers. So only a very small portion of the 13 million, in my estimation, are in fact prevention oriented. Most of them have a high treatment bias. Also, most think that they know about prevention. So most healthcare practitioners or healthcare people feel that they know all they need to know about prevention. At the same time, they don't necessarily put that knowledge into practice. Healthcare is stressful and 24/7. So if you're looking at any kind of residential or overnight care, you're looking at a process that goes on 3 shifts, 24/7, all the time. So that makes a lot of what is done in healthcare very stressful for the workers that are involved in providing it. In addition, healthcare workers are generally unhealthy. So if we look at the populations of people who work in healthcare, you would think that they would be healthier than the general population. But by most parameters that I have seen, the studies and research basically shows that they have a higher risk prevalence, more likelihood of more severity, and more likelihood of multiple risk factors. So as a population, they are not as healthy as we might think they would be. In addition, they're better at taking care of others than they are themselves. So their self-care aspects and self-care perspective is oftentimes not as good, even though they know in an intellectual way what needs to take place in order to maintain health. The US healthcare system has been undergoing very significant change through the ACA. So that changes that have come about through the Affordable Care Act have actually added a good deal of change and uncertainty to the way in which our healthcare system operates. The 2016 election now puts more uncertainty into that mix. And a high demand and high rates of change are likely ahead for the healthcare industry. So in terms of thinking about the future for these types of workers, this is a population that I would suggest is at general risk. And finally, personal wellness gets squeezed out by many of these dynamics. So the ability to have, for instance, the very high female content that exists in the nursing field means that those people that are nurses oftentimes have family responsibilities that are significant. So the ability to have personal wellness actually gets squeezed out by the dynamics you see from these bullet points, but also from their own home situations and own family situations is also present. Now, the reality that is only that about 20% of those in the healthcare field are intrinsically motivated for wellness. So if we think about that, the implication is the other 80% are not intrinsically motivated for wellness. So if we are looking at this in terms of our challenge of wellness, 4/5 of the people we're going to be dealing with in the healthcare field are not innately, intrinsically motivated for wellness. So that means that we have to come up with strategies that actually engage with them or involve them in terms of their own wellness. Another aspect is that wellness is about long-term behavior change, but changing long-term behavior is very difficult. And we also have the problem that many healthcare providers and practitioners don't do what they know they should for their own health and well-being. So we have this dilemma that we're talking about long-term behavior change, making changes in that when people actually have much of the knowledge about what they should be doing. But for whatever reason, they don't choose to act on that knowledge. Now, the unique wellness needs of caregivers, I would put into this category. First of all, it's a very diverse population. So we see ethnicity, we see culture, language, the backgrounds that they come from in terms of technical training. There's a lot of diversity in these populations. Next, we have the problem that in many healthcare facilities, we're dealing with multiple shifts. So we have the problems of delivering wellness to workers that are working at various shifts around the clock. It's also very stressful work. So that work of providing help and assistance and the healing arts to those that are oftentimes in pain or in a state of health that puts them at severe risk, that's part of the dynamic of healthcare workers and caregivers. In addition, high health risk prevalence. So as we look at the numbers of people who smoke in the healthcare field, as we look at their obesity issues, their sedentary nature, the issues around cholesterol, blood pressure, use of various kinds of risk reduction activities and injury prevention activities. All of those tend to show fairly high rates of prevalence of those risk factors in our healthcare populations. There's also that strong treatment bias, and that basically means they're thinking they are familiar enough with the treatment modalities and treatment options to think that they can go ahead and act in a certain way and actually have treatment that will fix the problem that perhaps their behavior predisposes them to come up with or to experience. So that's the depth of that treatment bias, and it causes, I believe, many people in healthcare to give a very limited value to preventive strategies, to wellness strategies. So that needs to be overcome when we start to think about providing wellness to healthcare workers. There's also the knowledge bias that's there. In a sense, thinking that they know about what these issues are in chronic disease prevention, and therefore they can in fact be immune to the outcomes or the consequences. So that becomes a form of knowledge bias that in a sense predisposes them not to necessarily work on those issues that are designed to reduce their probability and the severity of chronic diseases. They also have relatively poor self-care skills. So they may in fact be either very dependent on healthcare activities, not very resilient, or not very desiring to know about how to be a better healthcare consumer. So that puts them in a position where they oftentimes have very poor self-care skills. So they're better at taking care of other people than perhaps taking care of themselves. There's also major occupational health risks that come along, bloodborne pathogens, physical injury that comes from patient transport challenges, and movement challenges, the ability to deal with shift and shift changes, and a whole realm of exposure to microorganisms that are particularly virulent. All the variety of things that can come into play. Also, our exposure to radiation, exposure to the various diagnostic entities and diagnostic activities of healthcare. So there are quite a few occupational health risk issues that are present in our healthcare workers. Also, they tend to be high users of healthcare services, and some of that is the familiarity of knowing about these things because they're inside the system. But they frequently have high prevalence of health risk, which lead to high prevalence of chronic diseases, which leads to relatively high use of health services. Also, because they are working in this healthcare environment, they usually have to have, in a sense, an attitude that these are good services. I'm involved in providing them, therefore they would be good for me. So when we look at the pattern of claims experience for healthcare workers, we're generally looking at what are called substandard or high risk types of health claims patterns. So they tend to be high users of healthcare services. So that also puts their cost of healthcare at a higher level than you would with a equally gender and age grouped population outside of healthcare. So they tend to be high users of healthcare. In addition, one of the unique needs I think that is there is that oftentimes familiarity breeds contempt. So they're exposed to a lot of this activity going on in healthcare, and that familiarity breeds a kind of a disrespect, if you will, or the ability not to place value on it because they're so familiar with it. Oh yeah, I know about this. I'm involved in actually delivering these preventive services to patients. So therefore, but we oftentimes don't get to the point of saying, I should really be applying this to myself. So that familiarity does breed contempt. So these are some of the unique wellness needs of caregivers. Now, the key well-being strategies for caregivers are these. First of all, to reduce health risk to eliminate future chronic diseases. So we still need to be focused on the prevention, the metabolic syndrome issues, diabetes related issues, heart disease, chronic obstructive pulmonary disease, all of the things which oftentimes we are working on in terms of behaviors which reduce health risk in the population and with the intention of preventing some of those future chronic diseases. The second well-being strategy is to minimize injury risk. And that means not just at work site, which involves things like bloodborne pathogens or injuries occurring secondary to patient transport or patient movement or equipment and the handling of equipment. There's a lot of work-related kinds of issues. But in addition, home safety prevention or injury reduction, recreational injury prevention, and travel-related injury prevention. So the ability for us to minimize those injury risk. Those injury risks are going to show up in our health plan cost, in our sick leave absenteeism patterns, our workers' compensation costs, our short-term and long-term disability insurance costs, and something called presenteeism, which has to do with the work loss that occurs when I stay at work and I have an underlying health problem. The third strategy, well-being strategy for caregivers, is to adopt a lifestyle that enhances personal resilience. So there we're looking at issues around our sleep and how much vitality we experience and how much energy conservation we go through during a day and how we use things like supplements, dietary supplements, or caffeinated beverages, all of the variety of issues that have to do with that personal resilience. So I can begin to help people look at how their lifestyle affects that personal resilience related issue. The fourth strategy is to cultivate your social support network. So we know from a lot of the surveys that have been done by the American Psychological Association, the National Center for Health Statistics, and the National Health Survey that healthcare workers tend to need more in the way of social support. What they're doing is difficult. So the ability for them to have a positive set of social support network and contacts and connections is obviously an important part of well-being. The fifth strategy is to maintain currency in personal and family preventive care practices. So this goes along with the U.S. Preventive Services Task Force There are recommendations for the clinical preventive care issues and helping the healthcare worker stay current for his or her set of issues which are relevant to their risk and relevant to the science around the age, gender, and specific lifestyle risk. The sixth strategy is to enhance and broaden self-care and consumer health skills. So that basically deals with how do we help the people that are inside the system use self-care strategies, self-care skills, and consumer health skills to a more significant degree. So it's really kind of helping the people inside on how to use the healthcare system effectively. And that's part of this particular strategy. We cover that, by the way, in much more depth in level 3, where we talk about all the skills that are involved in those two areas, along with the injury prevention area as well. The seventh key well-being strategy is to maximize work-life balance skills. And so that really comes into play in terms of how do we help the healthcare worker also deal with those underlying demands, underlying challenges that come along with our lifestyle choices and how those things interact. So that goes back to some of the things covered in other of our modules, and it's handled again also in a later area in level 4, where we look more at the work-life balance related skills. The eighth well-being strategy is to emphasize well-being aspects of wellness. So our ability to move beyond the clinical related issues of chronic disease prevention to include the injury risk and also to include issues which have to do with vitality, energy, purpose, meaning, all the variety of things that are underneath the well-being moniker. And by the way, there's another continuing education module that covers the well-being aspects of wellness. So that's the strategy number 8. Strategy number 9 is to cultivate an exemplar aspect of healthcare workers. And that's where we actually consciously create cultural norms. And norms are essentially expectations that we as individuals have about what other people think that we work with, think about our behavior, and to actually create a value around being a health and wellness exemplar as a healthcare worker. So it's the ability to have the program actually place more formal, explicit weight or value on people leading in the wellness area. The 10th strategy is to build programming around personal resilience. So the ability for us to actually have a program that essentially emphasizes people's resilience to be able to provide good quality, good technical quality care, good patient subjective care, and be able to do that in a way that allows them to have the resilience to contend with the demands that are oftentimes erratic in healthcare settings. So these are some of the key well-being strategies for caregivers that I would recommend that you think about when you are doing any kind of consulting or leadership around healthcare populations and wellness programming. Now, there also are 10 additional ways to maximize your program's results in healthcare settings. These are also addressed in another continuing education module. So first of all, you can improve the brand identity of your wellness program within that worksite and within that healthcare setting. So that brand identity has to do with name, logo, art standards or graphic standards used for the program, the tagline. Those are all things that as they get more attractive and more appealing, that will strengthen the effectiveness of your program in producing results. The second strategy is to strengthen your program's AMSO. And AMSO is that construct that developed by Michael O'Donnell that has to do with awareness, motivation, skill acquisition, and the opportunity to practice. So those 4 things have to be in an effective wellness program. So you can in fact work formally on strengthening those long-term behavioral requirements of a wellness program. The third strategy is to include spouses in programming. So we want to do that because spouses are going to influence our spend in if they're covered under our health plan as the employer, but we also want the combined synergistic effects of having both spouse and employee working on wellness in a similar way. So that strengthens the behavioral effectiveness of programming. The fourth strategy is to move to a results-driven wellness program model. So we move away from the feel-good model or the traditional wellness model and move more toward the productivity-oriented, results-driven wellness program model. The fifth strategy is to strategically select your prevention targets. We'll cover that in a moment by looking at some targeting that is specific to caregiving populations. So we can be more strategic in our choice of what we're going to address in our wellness program as a prevention target. The sixth strategy is to use medical self-care, consumer health education, and injury prevention with our populations in healthcare, so that we have greater effectiveness at affecting the economic parameters that go along with those 5 areas I mentioned just a moment ago: health plan costs, sick leave, workers' comp, disability, insurance costs, and presenteeism. The seventh strategy is to better integrate your program. So that's where we talk about the 3 levels of integration. We may get better level 1 integration where our wellness components are connecting with each other and they are better integrated. We also have level 2 integration, which allows our wellness program to integrate better with other health-related functions in that organization. So that may in fact be benefits or EAP or staff development or occupational health, or in the context of hospitals, employee health. So that's a better integration of program as part of your strategy to increase results. The 8th strategy is to require an annual coaching encounter for everyone. So to basically connect that with a well-being survey and have the opportunity for people to formulate at least one wellness objective or goal during the year. So the ability for us to have a coaching encounter as part of our program. The 9th strategy is to increase the size of any premium incentive. So if we're using a premium contribution incentive, which is the most efficient way of incenting populations around wellness, if we increase the size of that premium incentive, we immediately increase the percentage of people who are participating in the wellness program. So that's increasing the effectiveness by increasing the participation levels. The 10th strategy is to use teams and formally recognize personal wellness achievements. So that's where we are essentially breaking this down into groups of people and then having sufficient focus for those teams to be able to recognize individual wellness achievements. So that's the 10th strategy, and these again are 10 additional ways for you to maximize your program's results in healthcare settings. Now, with this particular graphic, we're talking about wellness targets for healthcare workers. And what I've tried to do is to look at the, on top of what's called the Big 8, which you may remember from previous work in the WellCert program. The items that have are in red are what I would consider to be those that are going to be likely to be of benefit to healthcare workers. So if we look at the lack of preventive screening, the excessive caffeine consumption, undetected depression, insufficient sleep or rest, eating disorders, elevated blood sugar, and prescription drug abuse and/or distracted driving, I believe that you will find those to be good targets for us in terms of dealing with working populations that are healthcare workers. In addition, we'll probably suggest that the items with an asterisk are likely to have a shorter term economic return. So we don't have to wait as long to see economic effects in health plan costs, sick leave, workers' comp, disability, and presenteeism. from those items with an asterisk. So part of our challenge and part of our solution is actually targeting our wellness programs with a little more sensitivity to what are the likely problems to be encountered by healthcare workers. Now, wellness as an organizational imperative in healthcare comes from, I believe, internal and external cost pressures, which are likely to increase. Even with the 2016 election, we are likely to see cost pressures accumulate in the remains of what is left in place under the Affordable Care Act and whatever changes are likely to take place in the political negotiations and compromise to come later. So we're likely to see continuing cost pressures affecting how our healthcare system operates. And a very typical way that I see that happening in the healthcare system is budget shortfalls. And I've seen budget shortfalls eliminate whole wellness programs, as well as eliminate whole departments of wellness in health plans. So I believe that internal and external cost pressure will increase, and that makes, I think, wellness more of an imperative for us in healthcare. I think also job performance demands will likely increase. I don't see the expectations that we have for healthcare workers getting more simplistic. I see them getting more extensive. An example of that might be the conversion from the ICD-9 to ICD-10. So we are immediately increasing significantly the technical kind of issues that affect much of healthcare. So those job performance demands will likely increase. Another reason why I think wellness is an imperative in healthcare systems is there's the competitive pressure are likely to increase. So as we move to perhaps more market-based solutions for long-term resource allocation in healthcare, which we are likely to be doing during the next decade, that in fact will have some significant increased competitive pressures created by it. In addition, care will become even more complex. And I think, again, the ICD-10 is a good example of the increasing complexity of healthcare. In addition, we have obviously the accumulation of development activities and research activities and how they are essentially affecting the way in which we deliver healthcare. So I don't see care becoming more simplistic. I see it becoming more complicated and complex. Precision medicine, I don't believe is going to turn out to be something that we're capable of doing. So I believe that we are going to continue to see fairly complex kinds of patient care needs. Retention will become more important. So if we're using competitive market-based ways of dealing with resource allocation and healthcare, then I believe that one of the issues that's going to increase will be the retention of patients, keeping them in our health plans, keeping them in our delivery, our service populations, that will continue to be a high priority. And I believe that quality employees will become more important. So our ability to deliver healthcare that meets societal expectations underneath the constraints of a changing and very dynamic governmental posture on healthcare will in fact put more of a need for quality employees. So these are some of the major reasons that we believe that wellness as an organizational imperative is going to grow in the healthcare system. Now let's consider what will it take to move forward in the healthcare system with wellness and well-being. First of all, I believe that it'll take a much more balanced perspective on wellness that balances the humanitarian rationale, the concern for people, the concern for those issues which are qualitative and quantitative about the labor that delivers the services in the healthcare industry, along with an equal concern for the economic issues and how worker health affects health plan costs, sick leave, workers' comp, disability, and presenteeism. So that balance needs to be there, I believe, in order for us to move forward. I think it's also necessary for us to desire to progressively implement all 20 of those well-being strategies we looked at. And we looked at 10 well-being strategies that were specifically for healthcare workers. Then we looked at another 10 of those strategies for actually increasing the results of our program. And I believe that healthcare facilities, healthcare services, and organizations need to do all 20 of those strategies. I think we also need to have the skills to move each organization forward. So that means the kinds of skills that we're trying to address in the WellCert program need to be out there in those healthcare facilities so that people that have a prevention and wellness orientation can in fact effectively move their organizations forward. I believe also that we need to use at least $100 a month health plan premium contribution created specifically to be used as a wellness incentive, and that waiver of that cost for wellness and well-being engagement and achievements needs to be the major force for how we get large percentages of healthcare workers actually involved in wellness. So if we want to be up there in the 85, 90, 95% of employees actively engaged in wellness, we're going to have to use something like $100 a month health plan premium contribution, which we waive if people are actively engaged in pursuing their own well-being and wellness. I believe also to move forward, we're going to have programming strategies to help translate some of that extrinsic motivation that would come from that $100 a month reduction in health plan premium contribution into intrinsic motivation. So we need to be able to work on why people are doing this, not just for the rewards, but also for any of the other kinds of intrinsic rewards that would come along with a pursuit of wellness, lifestyle choices, and behaviors. And I think also we need to have the use of credible metrics for tracking. So our ability to, as healthcare organizations, health plans, and others, we need to have some credible metrics for how we track these kinds of programs and their effects. And I believe we also have to have the use of enterprise-wide, well-integrated programming. So that means that our approach to wellness and well-being needs to be enterprise-wide, and it also needs to be utilizing various kinds of interventions that are well integrated, meaning they connect with the various groups in our population, the various functions, and they feel seamless and they feel effective to the people that we're trying to reach. So these are some of the things that I think will be necessary for us to have in order to move the wellness agenda forward in healthcare settings. Now let's summarize some of the key points from this particular CE module. First of all, healthcare workers have challenging wellness needs. They're unique in many respects, and they're fairly intense or severe. In addition, wellness is a lot more difficult than it looks. So I think we've been sold a bill of goods that somehow wellness just takes a little bit of effort and you can do a few things and it produces these huge results. I have not found that to be the case in working with more than 1,000 employers and about probably 70 to 80 healthcare systems. Wellness is a lot more difficult than it looks. Wellness needs both a sound humanitarian and economic rationale. So if we get loaded up on the humanitarian reasons for wellness and we ignore the economic reasons, I think you can get into trouble. At the same time, if you ignore the humanitarian reasons and focus on the economic reasons only, then I think we lose our connection with our populations. So we need to have both the humanitarian and economic rationale in some sort of balance for our organization. There are 10 unique well-being strategies for caregivers. We went through those. Then we looked at 10 additional wellness strategies that would increase results. So those 10 unique well-being strategies are specifically for caregiving situations, caregiving populations. Results-driven wellness is needed to achieve those well-being strategies. So if you look at the nature of those 10 unique well-being strategies, they are best served with a results-driven approach to wellness. There are tangible strategies for maximizing the results of your wellness program. So we actually have 20 that were covered in this particular module. In addition, wellness is an organizational imperative in healthcare organizations, and that is what we went through in terms of the rationale for that. There are specific programming strategies to move your wellness program forward. So that's some of the things that have to do with how do you make sure that your organization progresses toward some of these strategies and some of these endpoints. And finally, you need to clarify your goals, align your strategies with those goals, and to hopefully achieve the needed results that your program requires. So in summary, these are some of the key points from this particular continuing education module. Now let's cover some key questions. And the first question is, what makes wellness programming particularly challenging for healthcare workers? And I believe it's the following things. First of all, it's the treatment bias rather than a prevention bias that exists in the vast bulk of those healthcare workers. Secondly, it's the familiarity breeds contempt problem, which means they're exposed to this so much that it loses significance or meaning. So the prevention stuff tends to drop out. In addition, we're also looking at a population of workers that have fairly high demand for wellness and for healthcare services. So we've got that as a challenge when we think about healthcare workers and their well-being. And finally, those poor self-care skills, I think, are another one of the things that makes wellness programming particularly challenging for healthcare workers. Second question is, why do healthcare workers really need help with wellness? First of all, I think that healthcare workers need better resilience given all the things that are happening around them and the nature of the healthcare process itself. I think, secondly, there's a great deal more uncertainty ahead, particularly with the 2016 elections. So that's going to then bring, again, kind of a higher change coefficient. There's more change likely ahead. And the fourth issue is increasing technical challenges. So the ICD-10 is just one of many different things occurring in the patient safety area and the diagnostic regimes in a lot of the other functional areas of healthcare. And I believe the last reason is that good quality care is difficult to produce and to consistently produce. So that means from the quality aspects that the patient experience is characterized by, much of that being satisfaction oriented, as well as the technical standards, which is really more of our clinical care aspects, our clinical standards aspects. So if you look at those two elements of quality, the patient perception of quality and the technical standards element of quality, those make the need for us to be doing some of these things to help healthcare workers even more imperative. The third question is, what strategies are particularly important for bringing wellness to healthcare workers? And I believe that the benefit linked issue is very important with healthcare workers because of their general, the range of salaries and wages that exists in healthcare systems, and the issues around the need for a more personalized strategy, something that touches the individual in an individual way. And the third issue is our need to bring into the wellness area, enrich it with well-being, so that that well-being aspect touches on those things that are not necessarily clinical in nature, but actually have a kind of a quality of life implication for those healthcare workers. And then the last strategy that I think is particularly important is a sensitive targeting of the kinds of interventions so that we choose targets which are relevant as you saw in one of the visuals, more relevant to these caregivers. And then the final strategy would really be one that is creating more of a culture of wellness. And that's where our culture has that exemplar role for wellness by healthcare workers and our ability to create a more consistent and more powerful cultural set of norms around wellness for healthcare workers. Now that you've completed this particular CE module, go ahead and take the quiz.